I'm going to show you today how to use a small ball. So this is a 9-inch. It's a soft ball, and I actually have them. So if you'd like to know where to get them, you can send me a message below, and we'll send you the direct link. But for today, I'm going to show you with this ball how you can work to prevent and get rid of back pain during pregnancy, pre-pregnancy, postpartum, and beyond. And I'm going to talk through some specific things of how we need to address our pelvic floor and deep core connection for both pregnancy and postpartum. And then I'm going to also talk about how this is really good in helping to minimize diastasis recti, as well as involved in the healing process of it. So many times with pregnancy, right, we get some postural shifts that are taking place, right? We either get like the tucked booty, we want to pull into the low back a lot because now we have all this weight that's pulling us forward. And so many times we don't realize it, but if we don't address that, whether it's during pregnancy or we don't address it once we're postpartum, then our posture tends to stay that way. And I've worked with so many women over the years that just live with chronic low back pain, but you do not have to. Okay, so with the ball, what I like to do, and specifically let's talk about pregnancy for a moment, because as you get farther along in your pregnancy, the biggest thing with this is you have to really watch that we're not over-activating our obliques specifically. We don't want any coning of the belly, right? So we think of our belly during pregnancy, you want a nice round belly. So if you're doing any exercises, and if you're doing this one and you're noticing that you're feeling like your belly is kind of pushing out and like that, making more of a cone shape, or sometimes it looks like there's like a little alien hopping out, then you need to kind of pull your body out of it and not activate your abs so much, okay? But this one works so good. So as long as you can do it through, as much of your pregnancy as possible, and then again postpartum without creating that coning of your belly, I encourage you to do that. Okay, so what you're gonna do, you're gonna take this ball and we place it kind of into the low back, and you can use your body for support. And I do recommend, even if you can do this, and pull your shirt up so you're a little bit more onto your skin. Otherwise your shirt kind of gets in the way. So like a good tip is like, just take it even and like tuck your shirt up, like up underneath your sports bra so that it's out of the way, okay? So you're gonna go into like your low back off to the side of your spine. So of course, when you're pregnant and later second trimester, third trimester, you're gonna wanna give your body more support, or even if you're doing this in those early weeks postpartum, right? So you don't wanna use our abs to have to hold us up, but you can use your arms here. So what you're gonna do is you can kind of even work your way back as long as that feels okay, and you're gonna lean into the ball, and I want you to think about breathing into that ball, okay? So you're gonna breathe in through your nose, send that air way deep down into your lower back, and then exhale, think about lightly zipping up pelvic floor, lower belly. So when you're pregnant, you're gonna think about like lightly hugging your baby. It's coming from underneath, okay? We're never drawing belly to spine. And then on the next one, you're inhaling into your low back. And then as you exhale, I want you to just kind of roll that ball to the side, okay? And then we're gonna inhale and bring it back. Good, and use your arms for support, ladies, so we're not putting too much pressure on your abdominals, right? And then roll to your side, and then back, right? And you can kind of play around with it. It can be more towards your sacrum, it can be up a little bit more, lower part of the ribs. And the reason why I do this with a soft ball, I don't do it with a hard ball, ladies, because it gives you a lot of give. We don't need a lot of pressure pushing into our body. It's really more for like tactile cueing. Okay, so as you exhale, wrapping around this way. Okay, so obviously when you're pregnant, ladies, we're only gonna go to our side, okay? If you are postpartum, you can then roll around a little more, so you can go from the back to the side and even you may even have to move your leg, and you can even roll around to kind of the front. So this is a great way to kind of lengthen out those obliques that can get really tight. Okay, and you can even kind of just roll back and forth through here, into the side. But the biggest thing here, ladies, is we're inhaling into the ball. So a lot of what you're doing here is breath work, and then we're gonna exhale, connect up lightly, pelvic floor, lower belly. Again, pregnant, you're gonna hug that baby. But if you're not, we're starting to think of zipping up, okay? So I'm gonna show you, ladies, one more time. So we kind of start from the low back, okay? Hands are supporting here. Watch your neck here too, ladies. We don't wanna be like all crunched like this. Like use this as like, I'm working my mid back a little bit. We wanna have that fascial tensegrity on, and then it's exhale, and I'm using my legs to kind of support me to roll to the side and back. Remember, keep it small. If you're pregnant, you're just doing that. And if you're postpartum, you can then go all the way around to the side to kind of start to stretch and lengthen that out, okay? Then when we go to come up, we're using our arms to support us, bend our legs in, starting to zip up from our core. So The cool thing about this, ladies, is, and notice it once you do that, I want you to then like kind of sit up and notice how that side feels compared to the other side. And then you start to really realize, oh wow, it's doing so much more than you may have even realized, because we get so restricted through there. And the magical thing about using a simple tool like this is that it helps to really help you facilitate where your breath should go. And there's so much opening and expanding and releasing of tightness and stagnation and energy that gets stuck, specifically in our low back, by doing something as simple as what I just showed you, right? But the thing about it, we're not using the ball to just push into our body, ladies. We are using it as like a tactile cue for where our breath should go. And it's okay in the very beginning if you have a hard time getting your breath to go all the way down into your low back. That's okay. It's very, very common, but you just have to start doing it. And as you practice it more, it will get better, okay? So just kind of back to review, like this is so good for helping to minimize that tightness in the low back. So you can use it for prevention. You can use it if you're getting some tightness, maybe even some discomfort in that low back. And then it's also good. Why is it good for diastasis recti? I mentioned that. So here's the thing with diastasis, ladies. Part of it is because, we get diastasis because, well, our belly has to expand and stretch during pregnancy, right? So, but when we learn to work with it and we activate our deep core in a correct way, and we allow expansion with light activation and connection, because our fascia can be so strong, but it also can have so much give. But because of the postural shifts that happen, right, we tend to pull in our low back. Think about that. If you just do that for a second, you're like, it's so much harder to feel the connection in your belly, right? So if we can work to release and lengthen, we're not using our back at all, right? It's helping to stabilize our body, yes. But so many times our body tends to cheat and rely on using our low back, when the reality is we need to use from the pelvic floor through our core, and then in the front, right? When you're pregnant, it's that light hugging or that light zipping up once you're postpartum, in pubic bone, all the way up. And so when we can work to open that up through here and keep this open, it can help you to have an even better deep core connection, and it can help you in minimizing diastasis recti, and it can play a huge role in healing. So if you ladies have any questions, please don't hesitate to reach out, and you can find more on my website at nactafitness.com.